Welcome, everybody. Here is the second day of the third progress report, where you will show your advances in the last 3 minutes. And as usual, I will briefly have an introduction concerning the program and what actually was about the last 3 months. And after, you will have the chance to show about your progress. I am more than happy to welcome again our international guests, also from Slovakia. Thank you very much for coming over. We have also university leader from Maribor. Thank you very much for coming over. Yesterday we had from the University of Iași, Romanian universities, and hopefully from next year our program will be even more international than actually currently. Just a brief overview. I usually refer that this is not about science, what we are doing. Of course, science is necessary in the 21st century to be a good doctor. Our vision is to bring science to healthcare, so you are treating patients in your future, and you will see them and you will have lots of questions, and in order to answer these questions next to the patient side, you must understand the implementation science, so-called healthcare delivery science. And of course our mission is to make a breakthrough change. Currently the scientific activity is not inside the medical training, neither of the residency. Our big aim, of course, in the future to make it possible that during the medical training you can do that. I think at Semmelweis University is a pioneer in this, because this is the very first time that this can be matched actually with it. Very importantly, this model is not only what we have discovered, but the Academy of Europea, which is the largest scientific organization in Europe, with 4,800 members, of which 73 of them are already Nobel laureates. And with them we could develop a model in which, very importantly, the scientific activity and also the communication, which means the education as well, are inside. And we are really very proud that last year Nature Medicine, which is one of the most distinguished journals worldwide, accepted our article. They found this 5 years development innovative enough to publish it, and here in a very large part is actually the education about the PhD studentship. This is a hybrid system. You also a medical doctor, you or dietitian or physiotherapist or psychologist. And it started 2 years ago at the University of Péter with 20 students. Actually, last year there were 17 students, and this year this was a big breakthrough. Now we have 91 PhD students in 8 different topics, and one of the topics actually pediatrics, which will start today morning, and in the afternoon there will be the gastroenterology and endocrinology. What is this program about? The main initiative part of the program is that people need protected time to do something in high quality. This is the major part of the program. Nobody can do high quality issues 1 o'clock in the morning and in the weekend. So, and in 1 year of your residency, you can get 4 days to do scientific activity, and in that case you need to do only 1 day clinical work. Of course, from the additional years it changed over, and you are mostly working in the clinic, but still having 1 day off for science. This allows you within 2 years to be 1 year off for science, and this is by the Hungarian health law. It's a law that if you finish your PhD in time, it means that 1 year, 12 months can be off by the decision of the university, which is already granted before, but of course you have to fulfill the criteria of a PhD ship. There were 161 applicants last year for this program, and we admitted 91 students for the different doctoral schools. And there are 4 phases, of course. Every 3 months you have a progress report. And in the first phase, there were very specific goals for you. This is the learning by doing technique, which means that during your scientific activity, you learn the methodology as well. So in first month in September, you most probably remember that you learned how to find the most important question, which is as important as in science than doing the activity. You learned how to clarify and simplify the question, and also how to design a project. And with the first 3 months, you could design, draft your PhD thesis. Everyone had learned the healthcare delivery science methodologies, so you had very specific training for meta-analysis, register analysis, clinical studies, randomized clinical studies, and everyone has started about in their first project about the data extraction. We were happy that 86 of you could achieve the next 3 months. 5 students couldn't take the speed of the program, and it's no problem. They went back to be residents, or they are doing their other jobs. The next phase actually was about when you learned how to write an article in the curriculum, how to communicate professionally, that how to put together a presentation, and how to interpret scientific results. Critically, this is what we, in every week, challenge was there about discuss your project. Of course, there were also compulsory part. Everyone was expected to complete their search in the meta-analysis. Everyone was expected to show results, and everyone was expected to present their achievements, and 85 students could join to the phase 3. The phase 3 was actually in the last 3 months. Here you also had an opportunity to meet and talk to top researchers worldwide, because we have a very big connection with Academia of Europe and Nobel laureates. We had actually the privilege of meeting with these people. You actually started drafting your first paper. Everyone was expected to complete the search and data summary and to present their achievement. Here is a summary table where we are actually currently. There are already 1 paper published, 2 papers accepted, 15 papers are submitted in the system. Of course, there are other studies, especially where large amount of articles were necessary to do the searchings, but currently this is the table what we have all together from all of the students. As I mentioned, you had the privilege to listen presentations. The first one was Ole Petersen, who is the Vice President of Academia of Europe, having over 10 papers in Nature, Science, and Cell. After, we could meet Jean-Louis Vincent, who is the most distinguished intensive care specialist, having a Hirsch index over 200. And you had a chance in the first part to meet online with Tim Hunt and Peter Doherty's presentation. And in this year, you had Sharok Shariat, who is the leading urologist from Vienna, Gábor Orbán, the CEO of Richter Gedeon. And actually, because there is also a good collaboration between the National Academy of Scientists education, which program is run in Szeged. You could join to the Szeged program actually in spring. And there were lots of students also from here who could discuss their projects with international experts, including Bert Sackmann, Erwin Neher, Aaron Chihanover. Here is a picture from the gala dinner. In the middle is Erwin Neher, Nobel laureate, who actually received the Nobel Prize in 1993 for discovering the patch techniques. Of course, this system couldn't go through without volunteer works of individuals, and I am more than happy to say that there were 2 people, the second and third year medical students, who did absolutely great work in the system. They were Szilárd Vancsa and Rita Nagy, and I am more than happy to provide them a certificate which actually signed by all the Nobel laureates were here about for their volunteers work. So I would like to ask to come over Rita and Szilárd. thank you very much again. And of course, there are a couple of things we have discussed last time. Actually, what kind of game-changing thinking needs to be successful actually in the program. I think at universities, one of the big advantage to have a huge amount of knowledge base. There are plenty of excellent professors, associate professors, researchers, scientists. However, there is written that success, sometimes we believe that this equals with knowledge. And the main issue is that this is not true. Alone knowledge versus, unfortunately, nothing without activity. So this equation is only valid if it comes with times of activity. And we are very proud that you are here because you provide to this system the activity and your supervisors provide actually the knowledge in the system. And if we put your supervisor's work and your activity together, this will result the success you can show here. Two very important points concerning the motivation and commitment. You were very motivated last September when you joined to the program. Motivation is important to start doing something, but to be successful is not enough. Most probably, when I saw your faces at the group meetings, I was not sure that every time you are fully motivated to do search keys, to write out extracted data, to go back to revise your presentations. So after all, at the time when you are away from the start, not the motivation, but your commitment, actually, which is very important. Those can be successful only who have actually large amount of commitment. And you are here because you worked a lot in the last 3 months. As usual, we have scoring systems. We try to make points after all. You will have this kind of program booklets. I also would like to ask, I think Danish you are at there, that also for the international guests bring one small booklets where they can find actually the class A, class B, class C point. If you go to class B, because this class B is over there with your phone, you can, it comes up, actually the reviewing part. And you need to choose that it's, you are either a CMT worker or supervisor or students. Also the international faculty could choose the CMT worker. You choose actually the 8 o'clock session, and after you can choose the name. And there are 7 categories about your progress level, importance of the science, scientific level, English knowledge, presentation skill, discussion skill, and the overall impression. Of course, the progress level is different for everybody because it's dependent on how big is your study. Of course, for those who has lots of study, big study, of course, they can progress slower. And those who has small studies, they can progress faster. So actually here is the point system, and it's written actually in the small booklet that those who has less than 7,500 articles for the meta-analysis, they get 5 points if their manuscript accepted, 4 points if it's already submitted. We will have students who are already at that stage. 3 if it's already sent out for language editing or internal review. 2 if the article draft has finished with the supervisor. And 1 if the article writing without results or not yet started the article writing. The second category, when you have a middle-sized projects with around 7,500 and 15,000 papers, of course here the points going 1 stage over, and the other is the 15,000, it's again 1 stage, because some of you have already big studies with over 15,000 articles to do, and in that case this kind of point system actually is different. There is also an innovation which was very successful last time, that all students, all of you have papers. Unfortunately, the international guests do not have this kind of card, which results a wine glass of wine after all. So those who are having students 3 questions, at the end they will get an excellent questionnaire certificate with a bottle of wine. There is always an excellence recognition in the program. There are 3 prizes. The best supervisor prize went this time to Péter, who is also the group leader of the dentist group. And actually this month the dentistry group became to be the group of May, and congratulations for them. They really showed high quality progress in the last 3 months. Of course, there are lots of activities outside of the TM, social club activities, sports activities, art activities. I know that some of you are already member of one of the clubs, especially the social club. Sometimes work well. Last time we had the Gatsby party, and I think also many professors joined to this kind of activities. So I would like to finish right now because the stage is yours. At the end, I will also, at the program, will say a couple of words what you will be need to achieve in the next 3 months. Thank you very much for your participation.